My name is Roberta. I'm a physiotherapist, and I have created this workshop for those waiting in the NHS waiting list for physiotherapy. Why did I create this? I used to work for the NHS, and I also worked for private clinics that were uh, contracted to see NHS patients. And over the years since COVID, the waiting lists have been increasingly high, and measures have to be changed to be able for staff and the institution to be able to manage everyone better. But unfortunately, the waiting list is still very high. And when I was in there, I just had this feeling of when I was seeing a patient in pain, still waiting 6 to 12 weeks. And a lot of the times, the hands on immediately would not be very beneficial. And 80 to 90% of the times, it was because someone was coming in with so much inflammation in the joint and the muscle in the injury that hands on would have aggravated the area. And I felt really difficult to explain that certain things would be wise to do at home on a daily basis to manage the inflammation, to kickstart the inflammation and allow the inflammation to follow the cycle into healing. Because if they are stuck in an inflammation, it's because the cycle has been interrupted and it's stuck in one part of the cycle. And I give advice on how to bring the inflammation to a final process of healing. And that can take about 3 to 4 days. And then be able to see them on the fourth day. Unfortunately, there was no availability to see them that quick. And they would be waiting another week or two, sometimes 3 weeks before seeing. So when I give the advice on how to minimize the pain, I would also give a progression right after. So they're not waiting and missing the window of opportunity to then introduce certain gentle stretches, not exercise, but gentle stretches to start, and then come back and then have the hands on to then give another level of improvement. Because every time we do hands-on, the it's very beneficial. I'm sure everyone can say this. However, it can be temporarily if the person is not following up with the training afterwards. Because with the hands-on, we can change how the tissue is behaving, how the tissue is holding tension. We can make it relax, but the behavior of the tissue needs training, retraining to be able to retain that relaxed state. So that's why we do stretches, we do exercises, and we ask you to perform once, twice a day for a period of time. If you are on a waiting list, and this is not a medical advice, but this is a very basic self-help type of advice that is commonly given if you are experiencing, of course, these symptoms which I will list. And the list is the signs and symptoms of inflammation in a joint or muscle, perhaps from an injury, perhaps from a chronic condition, or even from uh, overuse, repetitive strain, back pain, neck pain. The spine is a joint, so back, neck, shoulders, hips, knees, ankles, elbows, wrists, fingers. These all are parts of your body that you can assess and use the advice. Of course, if you are in this, you are on a waiting list. You have gone through our GP. You also have been referred to a physio, maybe even spoken to a physio over the phone, and you are not experiencing also certain signs and symptoms that you have ticked the box before you started the video. And of course, if you are unwell, temperature, you know, dizziness, vomiting, anything like that, it's you go back to the service the NHS offers for urgent care, your GP, and this is where you go. This is for musculoskeletal pain, the pain that you perhaps experience a few times that we call flare-ups, pain that you uh, have been managing for a while, for example, back pain, but for some reason it has become more difficult to manage and your strategies doesn't seem to be working. If you have arthritis in the joint, osteoarthritis, perhaps you pull the muscle and things like this. If you are experiencing bruising, I would like you in the tissue, in the skin, I would like you to go and see someone. Definitely go see someone. Even if you have to pay private for that only session until you get the NHS session, make sure you go see someone. And if you are experiencing excruciating pain as well, please follow your gut, follow the advice to get urgent care. So I'm expecting to see people here that are experiencing redness in the area of pain that are perhaps constant background, on and off pain with certain movements, and mainly, that's the key, pain at night. Pain at night is a sign that the tissue is aggravated and there is inflammation. You're also experiencing a small limp, for example, because you're trying to compensate to take the pressure off the joint so the joint doesn't hurt as much as you walk. Or if we're talking about back, neck, shoulders, that you are finding that you have to avoid reaching so far with your arm or moving your neck so far, and there's stiffness. Any signs of pins and needles and numbness to your hands, fingers, legs, and feet, you will be going to see your GP and discuss about it. This is not the place for this. I'm looking at signs of inflammation on the soft tissue. You can also experience a little bit of swelling. The swelling could go on and off. You can make it go down and then eventually comes back again. The swelling could be in the knee joint, ankle, for example, if you sprained your ankle, could be in the fingers, more related to arthritis, and even a little bit in the shoulder. Some people can experience a little bit of swelling in the shoulder. Heat coming out of the area. We experience this and very easily understand this if I say that you have back pain and your lower back feels hot more than other parts of your back. You can experience that in your knees, elbows, shoulders, hips, okay, ankles. So if you're experiencing then a little bit of heat of tissue, a bit warmer than normal, then of course this is possibly inflammation. And most of all, in terms of pain, if I want to describe the type of pain that you are experiencing, if it is sharp and shooting, you will go straight to speak to your GP and NHS 111 and find out advice from them. If your pain is achy, throbbing, a bit dull, even sharp with certain movements, but it goes away, then perhaps the tissue is inflamed and it's complaining when you are moving, it's complaining when you are trying to use it or push through. So the first advice is do not push through. I'm not asking you to, put your arm on the side and not use it or stop walking. But what I'm asking you is to minimize the amount of time you are on that joint, that you're putting pressure through that joint, that you are moving that joint in points of pain. So you can move your joints up to here, and that's fine. You can use your arms in this zone. But as you go above you feel like you can pinch something, it feels a bit more sharp, don't keep pushing through to it because you are then creating more inflammation. Another advice is to slow down your pace, slow down your movement. You will notice that you will slow down anyway with neck pain and back pain. And that's because the tissue is busy protecting you. So we need to slow down and give the space for the tissue to do what it needs to do. And what it is trying to do is to resolve this inflammation. If we keep moving fast and aggravating it, this is when the tissue gets stuck in an inflamed state. And by moving slow, you're also lowering the level of activities that you can do in a day, because if you're moving slow, you're going to get less done. It's going to be less intense. You're putting less load through your body. So therefore, your body then is entering that state of resting. So I would advise to rest the joint, to avoid putting the joint through pain. Yeah. And take it easy. Just take it easy. Sometimes you only need 2-3 days of taking it easy to notice the pain decrease. And you're also going to notice, which is a very good high correlation, is what you do in a day. You only know if it's been aggravating that much if you have pain at night. The nighttime pain is your reflection to understand how much are you doing in a day. Because what you do in the day is aggravating, the tissue then goes into repair mode at night. And when it goes into repair mode at night, you will notice the activity, the pain. It can swell up a little bit, so there's more pressure, the pain signals are a bit more constricted, the nerves are a bit more active, so you feel more pain. And you probably think, well, I don't have much pain in the day. And that's because you're busy, that's because the tissue's moving, there's circulation, and the pain signals are moving and mobilized. But when the pain signals and the nerves are all static, then there's very little circulation, so there's no time for that flush to happen. Okay, that's why sometimes people elevate the leg or elevate the arm if they feel, a swollen finger, for example, they elevate because then the flush starts to happen and then there's movement. So another strategy to use is elevation. For example, for knee, you want to elevate, put the leg up. For swollen ankles, you want to elevate, put your leg up. If your wrists are fingers, wrists are sore, perhaps sleeping with your hand out can help with the throbbing at night. But again, you want to understand how much are you pushing through. Are you knitting a lot? Are you walking a lot in the day? And that's why things are aggravating at night. And of course, I mentioned about the tissue being warm, being red. If you touch the tissue and it feels warmer than the other one, or around the same area, so here it feels normal, but feel really hot, and that is where you have pain, you cool it. We cool the inflammation. So inflammation is really out of control, and I'm speaking very simple terms. I'm not going into the biology of it or the scientific explanation of it. I'm really talking about very simple, because this is how you notice. You notice, oh, my knee's hot, my shoulder's hot. You will cool it. So you will use, you can use a cool compress. Yeah, so like even just a wet towel with very cold water, wring it, place it on top, leave it there for a few minutes. You notice then it goes a bit warm. That's time to put another one, replace with another cold. Ice packs as well. Make sure you cover the skin with a cloth, put the ice pack. And the advisory here is, please, if you ice, it's between 10 and 20 minutes, no longer. This is one session. You perhaps only need 1 or 2 in a day, and quickly drop down to 1 and then quickly don't need to do it, because you're going to ice depending on the temperature that you feel on your joint. You're not going to ice just icing, only ice and cool it if you notice that the temperature has been warmer. warm again. So you iced in the morning and then it's warm again in the afternoon. You can do another session then. As you ice your joint 20 minutes, as I said, take the ice off and then rest. Do not walk on the joint that's being iced. Do not try to use the joint that's being iced, for example, wrist or shoulder. You want to rest it. You want the temperature from the skin from going from very cold, of course, because it's been exposed to the ice, to then normal temperature. So you should be able to test and see, right, now it's gone to normal temperature. Then I can move around, I can do what I need to do. The reason I say this is because when you ice a tissue, there is a protective mechanism that is quite normal to happen, which is the flush of blood comes out of the area into the middle of your body to protect you from perhaps possible hypothermia, yeah, frostbite. So the body goes into this protective mode. Why do we need the body to go into that protective mode? There's a couple of reasons. One, because it pulls the blood out of the area, and then when it warms up again to normal temperature returning, it flushes the blood back out into the area and then flushes all the toxins that the pain and inflammation has been building up in the area because you wasn't able to flush. Okay, and that's the reason why you're helping the inflammation process to continue. So it's very simple. So while you take the ice off, perhaps another 10 to 20 minutes, depending on the person, on the application of ice or cool compress, you will understand that the temperature is going back to normal. And that's when people notice that they feel that flush of circulation coming back, and that's good. You want that happening. You want that area flushing of the toxins that the inflammatory process stagnant have created, like a little soup of toxins, and you want that going away. Another reason why we don't move about, and again, like I mentioned, the nerve signals to the tissue, to the muscle, are weakened because of that pool of circulation plus the coldness. So if you are trying to walk on a knee that's been very cold, you're not going to have the understanding for perception where the knee is. So it could crumble under you, it could collapse, it could twist, it could you won't notice. It's just going to happen. It's like trying to walk with very cold toes. You know, you come out from a long walk, it's cold, your toes are a bit frozen, and it takes a while for you to feel your toes on the floor, or your fingers when it's frozen, you struggle to hold things and write, and it's the same feeling. So you don't want to be playing on your joint while it's still cold and not knowing what it's doing. You know, like when you numb a tooth and you're trying to bite, you probably had this experience, you don't know how much power you're pushing through because you can't feel it. So this is why ice is important, but also important to give the time afterwards for you to allow the tissue to go back to normal, and then you can create gentle movements. And when I say gentle movements, let's say, for example, the wrist, nice and gentle movements, moving slow, gentle, only to the movement that you can do without pain, right? Really gentle, really slow. The same with the knee. You can bend the knee and straighten really nice and gentle. Ankles rotate, hips go, sit down and do gentle opening, closing legs only as far as you're comfortable. Shoulders, shoulder rolls, very gentle. Perhaps use your hands like this and do like a baby rocking, and only as far as you can do without pain. And why do we want to move without pain? Because now we're thinking about the nervous system. The nervous system is being triggered, alarmed, and there's an alarm button right here. And the alarm button is saying, right, I'm going to make sure she has a bit of pain so she doesn't move, so I can heal the body. Yeah, your body's trying to heal you. And then that alarm button is going off. Then you put the ice. The ice, you switch things off a little bit, you flush toxins a little bit, so there's less input for the alarm to go. There is something really dangerous in there. The alarm goes off the line. Okay. And then you say, oh, I feel really good. There's very little pain. And you start moving really fast and you pinching again and feeling the pain again. So the alarm button comes down again and goes, right, that's pain. Let's protect her. So then you go back into that cycle again of being stiff or painful or, unable to move as well. So this is where I bring the understanding that um, the nervous system needs time to feel safe. And that's why moving slow and gentle, very slow and then gentle and little and often through the day will tell the nervous system that you are safe to move because you're not moving and triggering the alarm system. And what I want to bring here as well, you might be asking about heat. So how should I apply heat? I've done in the past it worked and now it's not working. Heat is good for more chronic pain, pain that you know that you have many times and it happens, come back and goes away. And heat usually works best for the muscle. If the muscle is very tense, very tight, and holding a lot of tension, you put the heat, it relaxes a little bit, and then you feel better. And then throughout the day, take the heat patch off, and the muscle starts to tense up, and then you're back needing to use the patch again. That is not necessarily an inflammatory problem. Yeah, a tissue inflamed, a muscle, well, a bit of inflammation in the muscle, but not necessarily an inflammatory process that is stagnant in a certain part of the phase of the inflammation and cannot complete the cycle of healing to then heal the tissue. It's more a muscle behavior. There's a muscle tightness. There's a muscle that is increasing tension all the time. It's responding to a stimulus. Could be a mental stimulus, emotion, stress. Could be a physical stimulus, another muscle perhaps underworking, and therefore the muscle has to come on a little bit stronger to support the joint, to make you move, to make you do what you need to do. So what I suggest with that is, of course, a tense muscle that when you have a tense muscle, you will know. Most likely, you can experience a little bit of stiffness or movement around the area, maybe even a cramp or twinge that you will be saying something or it feels like it's going to go, and then I can make it stop if I don't move too fast. So all the other advice for that is the same. You slow down the movement, you don't move as far as the pain, and you do gentle movements. But that's when you go and say, right, what's about? Should I use ice or should I use heat? It doesn't hurt to use either. Um, you can try ice and see if that gives you any type of change and relief, and then you can try heat and see if that helps you with the relief. What I found is when people use heat, it's great. The muscle relaxes, but then the muscle becomes tight again, and then we're back on the heat, and we can be doing heat 2, 3 times a day. And how to stop that muscle from going tight again. And I'm going to give you just a little trick. It is a little technique. It's more of a concept for you to understand. And this way you'll be able to assess yourself and touch your muscle and have an idea if the muscle is tensing up. And it's good to try different times of the day because you might notice the muscle could be a bit more softer in the morning, and then you start moving busy, and then it's a bit harder to touch, and then you know the muscle is going into that behavior. So that's where we use gentle stretching. Again, I would consider using stretching that is uh, gentle and slow and pain-free. Do not stretch into pain. We stretch very gentle, very slow. But one little technique that you can use to try and find out if that muscle is tighten up, and I'm talking about if you think of lower back, so just when you put your hands on your waist and you can feel the muscles, you can palpate, that means touching and press a little bit. Chest, you can press around the chest here and see if it feels really hard. If you touch here, You can also go along the line of the muscles of the neck, and you can tell if one side is softer than another. But not another little way to understand what you're feeling is if you do a fist like this, and you see this area of between the thumb and the index finger. Okay. If you have a relaxed fist, this is going to be soft. See how much my finger is going in? That's more like rare medium meat, yeah, when it's being cooked. Then I use a little bit of more firmness to my fist, and I press, and I'm going in, but not as much, but I can sense how it bounces back a little bit more. That's more like a medium cooked meat, yeah. And then you really bring it a strong fist or a cat under the fist, and it's really hard, and you can see there's really bounce. This is a well cooked meat, yeah. If you're going over your muscles, if you're lying down and you are relaxed, and you can feel the muscles, especially the one that you are in pain, the one that's twinging, the one that's giving you grief, then you want to check and see how tense it is. And this is where you're going to check at different times of the day, make a little note, and then find ways to stretch that muscle. You probably are already stretching the muscle without realizing. You know those movements that you do um, that you think, oh, I just need to do this. Yeah. And you feel like something go a little bit easier, and then it builds up again, and you find yourself doing it again. You're already reading your own body. You're already listening to your body and doing that stretch. What can you do with that information? And this is the magic, okay? What can you do with that information? This information is amazing. It's the best information you can have from the body. You understood, you listened, you actually performed it, you know it goes away, so you know it works. But it needs to work in a way that is not just temporarily. And how do we transform this technique that you just learned from yourself, this movement, this stretch that you just learned from yourself, into a technique that can get rid of that tension long term? And this is the magic. So listen carefully. So what you're going to do is the movement is great. This is the movement that gets rid of that tension temporarily. You want to do that movement little and often through the day before the need to actually do it. So for the first part of the morning, or perhaps the time of the day that you feel you need to do these movements more often to let go of tension, make note of how long from one movement to another it takes for you to feel the need to do it. You might miss the couple of times you do it because we're doing very unconsciously, yeah, very intuitively. But as you realize that you're doing it, make note, 1 o'clock in the afternoon. The next time you do it, 1:45. This is your window. 45 minutes, that muscle is building up again. And that 45 minutes could be related to whatever you're doing in that 45 minutes. It could be the sitting posture that's causing the tension to build up. It could be the function at work, moving your arm in a certain way all the time, that, repetitive movement that is causing that muscle to build up. And remember, that time frame will be different throughout a different time of the day. But the times that you really notice, pick that time. Just work with that time. Don't worry about the rest of the day. You're going to stretch not at 45 minutes, you're going to stretch maybe at 35 minutes. So stretch every 35 minutes. Just that movement that you just done, just the one, takes you less than a minute. Gentle movement, slow into it, hold the stretch, feel the stretch ease by itself. You've done it. Okay, 35 minutes. Repeat that through the day. Then the next day, around the same time, when you notice that you've done the movement, and then time it to see the next time you do it. And you will notice that it won't be 35 minutes, it won't be 45 minutes, it could be 2 hours. It will increase. I call this a grace period. You created a grace period for that muscle to stay relaxed. and you want to work within that grace period. So what you're going to do is simply 2 hours. Okay, I'm going to stretch at the maybe the 45 mark, or maybe at the hour and 15, or maybe at the hour and a half, and work with that. So then every hour and a half, you're going to repeat that stretch, that stretch, that stretch. Day 3, so we're down to day 3. This is not protocol. This is just a progression of how you can utilize this to create long-term changes. I believe that by day 3, that 2 hours will be much longer and you'll be able to work with that. So if it's 3 hours, you're stretching 3 times a day, and that's it. So you are gradually improving the ability of that muscle to not tense up, to stay relaxed, yeah, increasing its endurance, and also listening to the muscle and responding to when it needs before it becomes painful. Yeah. So this is where the magic happens. This is where the change happens. And the same with the inflammation. If you are in the NHS waiting list and you are in that state where there is swelling, pain, pain at night, stiffness, redness, and warmth through the skin that you can feel, you are in that inflammatory window. Okay? Anything beyond that, this is not the place to get advice. But anything beyond that, please contact your GP. Please um, seek medical help and have a discussion, have a chat, share your symptoms, and go from there. But all the strategies that you can do from this video, you are already doing. You are possibly already taking anti-inflammatories or using anti-inflammatory gels. You're probably already taking paracetamol, and I'm not here prescribing. I'm not allowed to prescribe, but you go back to your strategies. Yeah, drinking lots of water. Hydration is very important for pain, and you are applying the stretches. You now understand that you can cool the inflammation if it feels warm. So you are then applying ice. You probably applied ice at one time or another in your life. So this is something you can go back to using. Or heat for the reasons I explained before. And make sure you cover the skin so the heat doesn't burn the skin. And then elevation, where you pull the body part up or the leg up. How do you do elevation for neck? And how do you do elevation for lower back? You don't necessarily need to do elevation for neck and lower back, or sometimes even shoulder. But what you do need to do is to find a position in bed with pillows in every place that you can think of to make you feel comfortable. And one trick is do not expect that position to be comfortable throughout the whole night, because every muscle that's not moving will create stagnancy. And if you are already in pain, it will bring the pain signals again. So expect that you are going to find a position that you can simply feel very comfortable, where the pain minimizes, where perhaps even switch off for a period of time. And that is your grace period. So remember, we were using stretches to minimize the muscle tension. Yeah. I'm not going to ask you to stretch all night. That's not what I'm asking. Well, I'm asking you to think of positioning in bed, a position that causes less pain in bed, where it will give you that grace period. And as you feel pain, you're going to wake up possibly, but as you feel pain, find another position. Try not to persist to that same position, because that's where the pain signals are going to come up again. So it's very difficult to fall asleep in a position that you're not used to. Very, very difficult. It's not going to change overnight. I've tried it, and I've gone through a journey with patients in clinic, where these journeys can take weeks. So, but it's important to feel pain-free or minimal pain, comfortable before bed. because then it allows you to then drift into sleep in that position that is less painful. If you are in pain, you're not going to drift in a position, even if that is your position of comfort to fall asleep. And another thing I want to highlight is things that you can do before bed to then soothe the pain again. So it gives you another grace period through the night, which can be the heat, it can be the elevation, it can be the ice, it can be the gentle movement, it can be the gentle stretches. So those things might be needed to be repeated at night. And what to expect from all this? I know there's a lot of information in the video, but there's everything's written down in the modules. Go through the modules so you understand exactly how to apply these strategies, when to apply these strategies. And one of the idea is to ensure that your nervous system is somewhat relaxed when you are applying these strategies so they work more efficiently. Meditation can help lower the nervous system. Being alone and not being interrupted, not being in a rush, all those things can lower the activity of the nervous system so that the nervous system can pick up the messages that you're sending back to your body to help it heal, to help it soothe the pain. And as you wait and as you are on the waiting list, this is a safe advice for you to continue to use the next few days until the pain eases and you feel more in control of it. It's really bringing the control of the pain. And you will get back to that point where you know you can manage with your strategies. Yeah. When the appointment comes and you are pain free, but is still hesitant to do things, right? Because something might creep up again. Go to the appointment. Take the appointment. Do not cancel because a physiotherapist can assess for issues in your body even if you are not in pain because of the way you move, because of the way you compensate, because of the way the muscle feels. Those are the signs that we're going to look for to understand what you went through while you're waiting in the NHS list. And that's why I always say to people, do not cancel the appointment once you're pain free. While I was working in the NHS and also the private clinic seeing NHS patients, the message that patients came with by the time they got to the appointment, right? They've been waiting for that long. And they say exactly the same sentence. I hear the same sentence from different people in different places. And they said, I feel like a fraud because now I don't have pain. But I'm not sure if I can go back to the activity they want to go back to because they're afraid they could creep in. And if you're going back to the activity and you're managing, fine. It's your choice, your decision. But if you haven't yet and you still want to go back to the activity, please attend the appointment because in that appointment, there's so much more physio hands can do, right? Physio eyes can do, physio knowledge can do to find out what to do to help you and bring you to the next level, the next pattern of healing. Because before, when you're waiting on the waiting list, you're down here, inflamed and tired and fatigued and frustrated and fed up. And then you come to this workshop and you found this information, you applied it, and you back here, but the mind is going, should I really go back to those activities? Am I ready? You know what? Go to the physio here where you are in control. Because then the assessment won't be aggravating. And if it is, then we're going to find out exactly the things that we need to work towards to help you go back to the activity. So I'm not here with this course, with this workshop, to take anything away from the NHS. I'm here to support the waiting list. I'm here to support you in the waiting list. And this is why I created this. Yeah, this is virtual physio. And it feels like a very basic information, but it can be life-changing when you are in that period of pain. And those 2, 3 days of following these advice and understanding this concept of the information, how to work through it, not through it, not pushing through it, but work with it, then it's life changing, because when you're not in pain, your mood will change, your perspective will change, your understanding will change, your empowerment to know what to do and what not to do will change. And I want to emphasize on the word rest, okay, before we finish here. I want to emphasize on the word rest, because when I say rest, doesn't mean not do anything and stay still. That alone will give the body more of a silent space to really send the signals really strong with pain. When I say rest, is don't push through activities that you are doing with pain because you think no pain, no gain is going to get you there. No pain, no gain has its place. And it's when you go back to that, when you actually manage to get to that physio appointment without the pain, right? Not thinking you're a fraud, but you are in no pain. And then you're able to do the exercise and work through it. That pain isn't threatening or damaging. That will be an exercise tolerance increase that you will go through. So if you are resting, you are minimizing the activity. If you're going for a dog walk, you're doing a shorter walk. If you are at work, sitting for long periods of time, you will be getting up and stretching and doing gentle moving, not stay stationary for that long. If you are in a manual work, perhaps light duties to allow you to continue to work but not push through your body in that way and create more damage. And if any activity that you're doing, to just soften, be gentle with yourself, and allow moments to put your leg up, allow moments to rest your back and lie down. It's about coming off gravity sometimes for a few moments at a time to be able to um, allow the muscle to do what it needs to do. Your body's healing all the time. We are the ones that get in the way. And this video is for you to understand the concept of inflammation and all the strategies you already use. I'm not giving you anything new. I'm just helping you understand how to use them, when to use them, why to use them, so it empowers you to then take back control and manage your pain better. Can we progress from here? Yes. Aluma Concept is another online workshop that I offer with weekly lives, and we go much deeper into this understanding of why pain is there in the first place. It's very good for chronic conditions and widespread pain issues. And this is where we're going to work through the subconscious to be able to understand why the pain is there, what's causing it, what's pushing it through, what's bringing it up, what's being consistent and chronic, and make changes, make continuous progressive changes, which I call the momentum of healing. We create that momentum of healing on a weekly session. It's online, and it will bring a very holistic approach, energetic approach, and also physiotherapy approach, because I can teach you certain techniques to be able to help you understand how to release a muscle. There's so many things you can do with your own hands, and your body's asking for it. And here, I'm here to help you understand what your body's asking, help you understand what the pain in your body means for you, for your story, and help you understand the pathways to self-healing. Yeah. And if I can show you how to feel and understand this, you can do it. You can do it on your own. So I look forward to seeing you at the Concept online program. In the meantime, I hope that you can improve your pain. And with this program workshop, you have access directly to me to ask any questions about you right now that you need answers that this video perhaps didn't answer. And then we can have a virtual call, a virtual physical assessment and chat and consultation, as part of included in this package. Okay, you don't have to pay any extra, it's included in this package, and it's there for you to use. So I look forward to seeing you. And this has just been a great space to be able to share this. And it's been a long time coming where I imagine something like this out there for people that are on the waiting